All right.
To the bottom of your Zoom window, you'll see some icons, and in the middle is an icon that looks like a word bubble. That's the chat function. When you click on that, that will open up the chat window on the right-hand side of your screen, and you'll be able to type in a message or a question and click enter. Then toward the end of the presentation, we'll ask any questions that have been posed. One other housekeeping item. If you need to leave during the presentation, take your mouse down to the bottom right-hand corner of the Zoom screen and you'll see a red box that says leave. If you click on that, you'll be able to leave. Okay. All right, to get started, let me introduce our speaker. Colleen Van Winkle has been with the Senior Health Insurance Benefits Advisor Program for nearly 10 years and has been involved in both community outreach and volunteer training and certification. Colleen has worked in government and nonprofit sectors for most of her professional life. So let's please welcome Colleen Winkle.
Hi, it's great to be here. Thank you so much, Carol. I appreciate the opportunity to share our information with the community. Like NKA, the SHIBA program has moved to doing virtual in order to continue to make information available to folks, but reduce the risk that people could potentially catch COVID either from us or vice versa, us from them. So thank you for inviting me to help people understand more about what's going on with Medicare over in the next year. And I'll look forward to answering questions as we go along. So today what we're going to cover are changes that are happening with Medicare in the 2021 year. And those include information about what's going on with COVID-19, telehealth services, ESRD, which stands for end-stage renal disease, and Medicare Advantage plans, senior savings program, acupuncture treatment, and online premium payments. Under the current emergency declaration, there is no out-of-pocket cost for COVID testing when it's provided by a participating Medicare provider. Most of the Medicare Advantage plans are also waiving costs for testing for COVID, but in order to check on the most up-to-date information, I would recommend checking with Medicare. The declaration is out there. No real end date has been put on it, and so it will continue in force. But as we learn more about COVID, we may find that things will change in order to offer the best benefits to folks in the community. Antibody testing, which is generally used to determine if a person has already had COVID, is also no cost with original Medicare. They will pay for at-home testing, but I would urge people to be very careful if you receive phone calls saying that they want to mail out test kits to you. All you have to do is give them your Medicare number. Those are often fraudulent calls, and you should probably not be contacted unless your physician or the health department or somebody like that has reason to believe that you need to have that test. Medicare does allow the MA plans to waive costs. However, that is at the discretion of the Medicare Advantage plan companies. So there is no requirement that they do so. Most of them are cooperating and picking up the tab for these kinds of things, but there may be situations at some point where that's not going to be the case. Telehealth is utilizing telephones, computers, video conferencing, a number of kinds of things to provide healthcare services to individuals. It's been around for quite a while, but there have been some changes since early March as the COVID pandemic increased and began to spread. In the past, there have been geographic locations, limitations, also sites of service restrictions. So in some cases, people have had to go to their provider's office, for example, and while at the provider's office be put in contact with a specialist. Those restrictions are now being lifted. Those telehealth conferences, meetings, appointments can be held at any geographic location, and they can, they're encouraging people to utilize these from their homes in order to get needed medical attention without running the risk of being more likely to come into contact with the virus. Also, there are no longer restrictions on the types of practitioners who can provide telehealth services. And under certain circumstances, requirements for video have been waived. Possibly a situation that might be found in that case would be discussion with a dietitian or discussion with a physical therapist. Those kinds of services may be done over just regular telephonic channels. As I said, ESRD stands for end-stage renal disease, and basically the folks that fit into that are people who are either on dialysis or in a kidney transplant program. And up and through 2020, the Medicare Advantage plans it was very limited circumstances under which they had to accept people who were in ESRD situations. Basically, it had to be someone who developed ESRD after they had joined a plan, or the person was covered under an employer group health plan, developed ESRD, became eligible for Medicare, and then the company that offered that employer group health plan also offered a Medigap plan, and then the person was allowed to get into it. But moving between plans was pretty limited. Beginning in 2021, folks who already have ESRD are going to be able to join plans just like anybody else. The important thing for folks to be aware of is that they must make sure that their dialysis center is in network with any plan they want to join. We've been very careful to check with companies as they've met with the Sheba folks to talk about what their plans for 2021 would entail. And they've all told us that for people who are in network, they are paying, the copayment would be 20%. Actually, it's coinsurance. However, that may not be the case if you're in a PPO and go out of network. And of course, anybody who's in a Medicare Advantage plan that is an HMO who goes out of network, it has no coverage. So it's real important to make sure that those dialysis centers are in network with the plan that you choose. The Senior Savings Program is an exciting new program that's coming out this year, where select enhanced Part D plans as well as Medicare Advantage plans with prescription drug coverage are going to offer plan choices with broad access to multiple types of insulin. Under these programs, the participating plans are going to charge a $35 copayment for the insulin products that they put into the Senior Savings Program, and that would be $35 in all coverage categories except for catastrophic, which would bring it down to 5% copay. This is brand new. We're just beginning to see it in place. And we are seeing that in some situations, we're seeing like a $35 copay after the Medicare Advantage plans prescription drug deductible is met, some other things. We're not sure exactly why it's working that way in the plan finder. So if you are self-serving, doing your own work on the Medicare Plan Finder at medicare.gov, and you run into those kinds of situations, I would recommend talking directly with the company that's offering the plan and verifying exactly what your responsibilities would be, because we don't want you to get any really nasty surprises down the road. The three manufacturers that are participating are Eli Lilly, and we're probably most familiar with their Humalog product. Novo Nordisk makes Novolog, and Sanofi Aventis makes Lantus. We're also noticing that there are generic versions of some of these insulin products out there. Those are not included in the senior savings program. And I actually have seen cases where the cost of the generic is higher than the cost of the brand name drug. So again, I would urge caution, looking for what works best for you in your situation. And the Medicare Plan Finder does have a filter available to look specifically for these plans. Medicare has been working on their My Medicare account information, and one of the things that they have allowed for now is that people who do not pay their Medicare Part B premium through a deduction from their Social Security or Railroad Retirement Board benefits can pay Part B premium payments online through the My Medicare account. It can only accept single payments. You would use a credit or debit card, or you can use bill pay with bank savings or checking account. And Medicare has begun to cover acupuncture in very limited circumstances, only for the treatment of chronic low back pain. The idea is to create an alternative to opioid treatments, and there are very specific criteria that must be met before they can start utilizing these services. First of all, the condition has to have lasted for at least 12 weeks, and they have there's a requirement that the pain have no identifiable systemic cause, and it may not be pain that it is not allowed to be pain that is associated with either surgery or pregnancy. The coverage is up to 12 treatments in a 90-day period. There can be an additional 8 sessions that they would cover if the person is showing improvement. There is an absolute limit of 20 sessions per year, and if the person isn't showing improvement or they're worsening, their condition is worsening, then the coverage stops. Other Part D news that we have, many of us were not aware, and it's always good to kind of go back and take a look at some things that may be of benefit to you out there that you didn't know about. And effective the 1st of this year, the Medicare prescription drug coverage plans were no longer able to tell pharmacies that they couldn't tell folks if there were lower prices for cash or other ways of getting their benefit. In the past, the plans had effectively put a gag order on those pharmacies that contracted with them. And of course, if a pharmacy isn't part of a plan's network, it's like having no coverage at all. So now the pharmacist is able to clue you in if there are less expensive ways of getting your medications than going through the plan. And there's been some misinformation around for quite a long time that you absolutely must run all of the drugs through your prescription drug coverage plan, and that is not the case. You can get that drug however it's best for you to get it. Beginning in January of 2021, the explanation of benefit forms that you will receive from your Part D coverage have to include information on drug price increases and also on lower cost therapeutic alternatives, such as a new generic coming out or something like that. Now, often generics are not less expensive during the first year that they're on the market. It's my understanding that during that first year they licensed to only one other company, but then beyond that year, then you see more companies receiving licenses to create the generic forms of these drugs. Part D plans are going to be allowed to substitute generics onto their formularies more quickly during the year. And people who need brand name medications, if they change out the generic for the brand name, but it's medically necessary that you have the brand name for some reason, you're allergic to one of the components that can make up to 5% of the generic or other kinds of things, with your physician's assistance, you can request an exception to the formulary, and the company will generally look at that and consider whether it is truly medically necessary. If that's the case, then they will probably allow you to substitute the brand name for the generic for the remainder of the year. And as I said, generics may not be significantly less expensive in the first year that they're available. In terms of costs for this year, the Part D maximum deductible is $445. Last year it was $435. The coverage gap begins at $4,130. That's the total cost of the medication. And catastrophic begins at $6,550 total out of pocket. And that total out of pocket may be made up of what's coming out of your pocket or anyone else who's helping to cover your costs. So if you are getting assistance through the PAN Foundation, which assists with co-payments or other kinds of services that help to pay for the medications, those amounts can be counted as well as what you're actually paying out of your own pocket. The Medicare Advantage plan maximum in-network out-of-pocket for this year is $7,550. Last year it was, or for 2020, it was $6,700. And combined or out-of-network maximum out-of-pocket for this year is $11,300 compared to $10,000 from last year. The average Medicare Advantage plan premium for Idaho for 2021 is down to $35.65 from $42.62 in 2000. There are 75 plans available in Idaho, and the greatest number of those are available in the Treasure Valley. 11 counties in Idaho still do not have any Medicare Advantage plans available to them. And people often ask how come they aren't required to be made available. Basically, it's a couple of things. One is called network sufficiency, and that's a requirement that Medicare has that says that if you're going to offer a plan to somebody who lives in a particular area, then you have to make sure that they have access to the necessary providers within a reasonable geographic area. In many parts of Idaho, there are no providers within that geographical area that they can go to. A great example is salmon up in Lemhi County. They don't have very many providers. Most of the people in that community either go to Missoula, Montana or Idaho Falls for their healthcare services. That's outside of the geographical area. So that's one reason that the plans have certain locations that they just don't offer coverage in. We have 12 plans that offer innovative benefits such as wellness, healthcare planning, reduced cost sharing, and rewards and incentives. 5 plans are in a trial program to offer to cover hospice benefits. Up until now, if you went on to hospice, those services all devolved back to Medicare Part A. Even if you had a Medicare Advantage plan, Medicare through Part A was paying for hospice. Now we have 5 plans in Idaho where if you are on hospice, the hospice will actually be paid for with the plan as a plan benefit. 9 of the prescription drug plans and 24 of the Medicare Advantage plans with prescription drug coverage will be offering the senior savings reduced cost insulin. We have 28 standalone plans in Idaho for 2021, and the lowest premium for this year is $7.30. We generally recommend that if someone has no medications that they take, no prescription drugs that they take, that we encourage them to go ahead and at least get the cheapest plan available, because at that point they then have coverage, even if they're to be prescribed a medication down the road that isn't on that plan's formulary. As I explained earlier, you can still ask the company to cover that drug for you if there's a medical reason for it. Also, if you don't have a drug plan, first of all, you start accruing penalties. And secondly, far scarier than having to pay a penalty is the fact that unless you're receiving assistance through extra help, then the only way you're going to get into a drug plan is wait till the next annual enrollment period, and your coverage won't begin until the first of the following year. If you're taking a really expensive drug, that could be devastating to have to do. I worked with a lady recently who had one drug that was over $5,000, one drug that was over $1,100, and finding her the drug coverage that would help her made it possible for her to be able to get that benefit. So, but if you are taking drugs, don't pick your plan based solely on the premium. Look at the medications that you take, find the plan that covers those drugs the best possible, and the Medicare Plan Finder is designed to sort based on your total drug cost for the year, whether you're looking at just drug plans or whether you're looking, or if you're looking at the Medicare Advantage plans that have drug coverage. Some dates to remember: our annual enrollment period for the Medicare Advantage plans and the prescription drug plans is October 15th. That's when it opens. The companies actually can start marketing as early as October 1st. They have to give you your Medicare annual notice of change form by October 1st. So you know what that way you can know what's changing in the plan you currently are in. December 7th is the date when you have to make all of your changes made in order for your coverage to begin January 1st of 2021. If you don't make a change, then you're going to continue in whatever plan you're on, or you're going to continue to not be in a plan, depending on what your situation is. In the last couple of years, we've also seen something new start, and that's called the Medicare Open Enrollment Period. It runs from January 1st through March 31st of every year, and it works this way. If you are enrolled in a Medicare Advantage plan on January 1st, then you can make one change and only one change up until March 31st. And the changes that are allowable are to move to a different Medicare Advantage or Medicare Advantage with prescription drug plan, or go back to original Medicare and pick up a prescription drug plan. There is no guarantee that doing either of those is going to allow you to get into a Medicare supplement, also known as a Medigap plan. But you're allowed to buy a Medigap plan anytime you can find someone who will sell you one. If you make those changes, any of those changes, then your coverage change will take effect the first of the following month. So if you make a change in January, your coverage will become your new coverage will become effective February 1st. If you do in February, it starts March 1st, and if you do it in March, it becomes effective April 1st. Okay, so I sailed through that. One of the things that isn't on this slideshow, because I put it together before we had the information, Medicare Part B, if you haven't heard, is going to cost folks $144.60. No, I'm sorry, I take that back. That's what it costs this year. It's going to be $148.50 next year. The Medicare Part B deductible, if you're on original Medicare, this year cost $198. Next year, it will be $203. So there are some increases. There will also be some increases in things like how much you have to pay for a day in the hospital if you're in for beyond the 60 days or beyond the 90-day time frames, things like that. And but that's a lot of detail to throw at folks when you know, not everybody's going to need that information. So Carol, if you're there, let's open it up for any questions, and I'll be happy to help folks out with what their personal concerns are about.
All right, there aren't any questions typed so far, but if I'm allowed, I'd like to make a comment.
Certainly.
Just from my own personal experience, I had been with the same Medicare Advantage plan for several years, primarily so that I could keep the same, it was an HMO, so I could keep the same network of doctors and same hospital. And I did get the, oh gosh, the thing that is mailed out October 1st that tells you about changes coming in the plan. I can't remember the name of the document.
The annual notice of change.
Right. And it did mention that some of the prescriptions, and I only take a couple of prescription meds, but that some of the prescriptions were going to be changing tiers in their formulary. And you know, that just kind of went by me. Luckily, I got a second letter from my Medicare Advantage plan company that I was with, explaining, actually naming one of the two prescription drugs that I was taking. And it's a good thing they sent that to me, and I started doing my due diligence, because the medication was going to go from $23 for 3 months supply to $700 for a 3-month supply. So at that point, I started shopping, went to Medicare.gov, which is a great resource, and was able to find something that makes it more affordable. So that wasn't a question, just a personal experience thing. If there are other questions, please type your questions in the chat box, the way I explained at the beginning of our session.
Also, I might take an opportunity while people are tapping away at their keyboards to explain a little bit more about the SHIBA program. We are part of the Idaho Department of Insurance. We're funded by both the state and the federal government because Medicare isn't simple. And if it were simple, they probably wouldn't need us. But because it's as complex as it is, we receive funding to assist people to find you know, to understand how Medicare works, first of all. Secondly, we can help them find plans. And third, we're also available to assist with problem solving. If you have an issue with Medicare, if you have an issue with a plan you're enrolled in as part of your Medicare, then we can probably help you with those issues, or at least explain to you why we can't help you with the issues. Our name SHIBA stands for Senior Health Insurance Benefits Advisors, and we are as I mentioned, funded by the feds. We're also part of a network of programs all very similar to ours called SHIP programs, which stands for State Health Insurance Assistance Programs. So there's a program like ours in every state, as well as the protectorates where Medicare is available, such as Guam, Puerto Rico, the Virgin Islands. So those are, lest you think that we're just some fly-by-night organization who pops in here to talk about Medicare, we are the main resource recognized in each state to help people with their Medicare. We also, because we are attached with the Department of Insurance, have the opportunity to work with insurance brokers and agents to help them help their clients as well.
At this point, there are no questions in the chat box.
Okay.
Dennis, I don't know if you want to send the link to our survey again, put that in the chat box. And while you're doing that, I will explain what that is.
It's already there.
Okay, thank you. Hopefully everybody can see the link to the survey. There is a link to the survey, to a survey in the chat box, which is in the right-hand side of your screen, your Zoom screen. If you click on that, that will take you to a survey. New Knowledge Adventures, as I mentioned at the beginning, this is our first year of having virtual classes. We're learning a lot, but we can learn even more from your feedback. So please do go to that, click on that link, and answer the brief survey questions, because that will help us improve for the future. Who knows what our spring semester will bring? We would love to be in person, but we may be virtual again. Again, if there are no questions, I'd like to thank Colleen for this excellent, concise presentation. You are a font of information, my dear.
Thank you. It's always my pleasure to come and work with the folks with New Knowledge Adventures. We enjoy it very much.
Oh, there is a question now. Aha, Sheena, thank you. Sheena Smith says her birthday is on October 23rd. Happy belated birthday, Sheena. When should I sign up for Medicare? So you'll turn 65 in October
2021?
Oh, okay, except it's
2023.
Not Medicare. I'm getting Medicare and Social Security confused. Oh, so in 2023, you will turn.
Okay.
Okay.
All right, so you have what is called an initial enrollment period, which is your gateway into Medicare. You have two ways to get into Medicare. One is to age in at age 65, irrespective of when your full retirement age is with Social Security. And a lot of folks think they're tied. They are not. So 3 months before you turn 65 is the very beginning of your initial enrollment period. It includes the month you turn 65, and it extends 3 months beyond the month of your 65th birthday. If your birthday is on the first of a month, then there's some special situations and everything moves back 1 month. But other than that, you're covered from the first of a month regardless of when your birthday is, unless it's on the first of the month. Then somebody decided that you actually turned 65 the day before your 65th birthday. Medicare rules say you are eligible, if you're eligible for 1 day, you're eligible for the entire month. So that's how come everything backs up a month. Don't know who some of the people were who were working on this project when it got started, but they created some very strange rules. And it's just our job to live with them, I guess. So the recommendation would be 3 months before your birthday. So let's take Sheena's example, and she's in October. We back up to September, August, July. July of 2023, Sheena needs to figure out where she's at. If she is still employed and not collecting any Social Security benefits and has health coverage, there's a number of things to look at, then she probably would want to, talk to us about all of the various options and ways that she can get in. If you are already receiving Social Security or railroad retirement benefits, then your Medicare card would be automatically sent to you about 3 months before the month you become eligible. The other way you can become eligible is if you are on Social Security disability. Then you normally become eligible for Medicare the 25th month after you begin receiving Social Security disability benefits, which is usually about 5 months after you get adjudicated for it. Two situations where you can be on Medicare and get it sooner are if you are diagnosed with ALS, otherwise known as Lou Gehrig's disease, you become eligible for Medicare immediately. If you are end-stage renal disease, which we already talked about, then it kind of depends on what kind of dialysis you're going through and some things like that, but normally it's within the first 4 months after you start on dialysis that you become eligible for Medicare. If you wait till the month that you're eligible to sign up, that's going to put off your effective date for your Medicare for a month. If you sign up any of the 3 months prior, you become effective the first of the month that you become eligible. All right. And if you wait for any of those 3 months after your month of eligibility, that puts you back even further every month. So the first, in November, you wouldn't become eligible until January. And if you waited till December, you wouldn't become eligible until February or March. And I have trouble when, I try and keep people from getting that far out so I don't have to figure it out. But yes, it's a really good idea not to give us a call at Sheba and say, hey, I turned 65 last week. What do I do now? You're behind the game. You're way back, and you've got a lot of catching up to do. So be proactive, think ahead, be ready to jump when it's time.
So Sheena, did you get all that, or is it a good thing we're recording this session? So I'm going to mention that for people who don't know, either most or all of the NKA classes have been recorded and they're available on YouTube. And oh boy, somebody remind me. I can't remember. Do you just type in new knowledge adventures Treasure Valley in the YouTube search bar, or is it something else? Oh, we can't hear you, my dear.
Is your microphone turned way down?
Yeah, even though your mic shows it's on, we can't hear you. So maybe you can just type it in the chat box and I'll read it. Okay, so you go to YouTube, and in the search bar, which will be in the top, hopefully everyone's used YouTube, type NKA Idaho, and then it shows. And what I did is you actually can subscribe, and then that shows the whole slew of classes that you can listen to in case you didn't get all of that information. Okay, are there any? I don't see any more questions. Are there any more questions? Last call. All right. Well, thank you so much, Colleen.
My pleasure.
You've given us a lot to think about, and as like I said, from personal experience, I've learned this year that you really do need to check, even if you're comfortable with your Med Advantage plan, and I was, you need to check and weigh all options. So thank you so much, and Sheba is a wonderful resource for us to have.
Thank you.
All right. Okay, Dennis, if you can, yes, we're clapping. We're all clapping. Some of us have found the clap icon. Yes, I will find mine. It's in the bottom of the screen by chat, everybody, if you want to clap.